Okay, doctor, at what time is insulin given to people? And they say generally once insulin is given, they put on weight and all that. Is that true?
So given a choice, insulin is the best medicines available for a diabetic patient. But there are patients, there are many reasons why we do not advocate insulin in the beginning itself. One is that type 2 diabetes patients can live without insulin. And again, these patients have their own inherent insulin, which is there, and we can always use their own body's insulin without increasing the production of insulin. So the medicines what we give initially reduces the insulin resistance, and their existing insulin itself will be enough to control the sugars. So there is no need for the absolute need for insulin to be started. So this is the reason why we don't start. But there are certain category of patients who are absolutely required to start them on insulin. One is pregnancy, where we cannot give medicines other than probably the metformin in a patient who is pregnant. So insulin becomes mandatory there. The other category of patients are type 1 diabetic, where they have no inherent insulin, so there is no role for a tablet. The other category of patients is type 2 diabetics whose inherent insulin is very low, and these patients are those patients whose sugars have gone very high. So there are times when their blood sugars have reached 500 or 600, because this cannot happen in a person who has some amount of insulin in him. So if he has reached 500 or 600 sugars, means that there is a severe deficiency. And another set of categories of patients are those who have developed a complication called ketoacidosis. So ketoacidosis happens only when there is a severe degree of insulin deficiency. So these are the patients whom we need to look them for a longer term insulin from the external source. And again, there are also a set of patients who are young and diabetic, who would probably also be controlled on tablets, but who would like to be on insulin, because they all know that ultimately insulin is the best. So we do not discourage these patients to start them on insulin, especially the basal insulin, because the basal insulin can be given once a day without having any complications of hypoglycemia. Again, this is easy to be administered. So those patients who are willing to start insulin early, we start them on a 24-hour acting insulin and continue to use shorter acting tablets and monitor their sugars. So it's again, many patients are reluctant. So even in patients who require insulin, they were reluctant to start insulin. So these are the patients very difficult, because we need to convince them. So again, many of the times we know that this patient do not get his controls with the tablets. So these are the patients whom we start convincing them that what is the advantages of insulin, and why likely this patient will not be under control with the tablets alone, and what is the advantages of starting insulin early, whether related to complications or whether related to quality of life. So these are the patients whom we need to start talking to them about insulin and slowly convince them to start insulin. But again, the later you start, the more amount of insulin you require, the more number of times you require the insulin.
Okay, doctor, once they start off with insulin, can they go back to tablets? Can they be swapped sometimes? Or in fact, some people, as you said, when they are traveling, they cannot carry the kids, they say, and they take tablets. Is that possible?
There are certain categories of patients where we require them to be on insulin only for a shorter number of period or some shorter number of days. For example, for a planned surgery, because there we are worried about their food intake, their pattern of food intake will be different. Sometimes we may not be allowing them to take food. So these are the patients whom we start them on insulin. So these are the patients where once they finish their emergencies or a planned procedure, we tend to go back to the orals. So, but there are patients who are started on insulin because there is no other option. So it's an inevitable situation where these patients need to continue on insulin for a longer number of times. So these are the patients whom we cannot look back and go back to the orals, because the very fact that these people are started on an insulin means that these patients fail to control with the tablets. So these patients, when we go back to tablets, they may not do very well. But many a times when patient is diagnosed very early, in countries like US, any person who is diagnosed to be diabetic, when their HbA1c is more than 8 in the beginning, they give insulin for a short number of days and move them to tablets, what we call glucose toxicity. Because we all know that when the sugars, body is exposed to higher sugars, there is some amount of toxic effect on the body. So these patients are started on insulin in the beginning. So the body, once the sugar is under control, there will be some changes which reverses in their body, and they slowly remove the insulin and continue on the orals. So other than these situations, many of these patients, when they started on insulin, will need to continue insulin for a longer number of times. Again, when they plan to travel, it's very difficult to swap them to tablets, because all said and done, the tablets are never equal to the insulin, and we have no fixed pattern where I can, this amount of tablet is equal to this, the number of units of insulin. So it's very difficult to match for these travel. And again, most of the insulins which are now available are stable enough to be carried. They can be kept off the refrigerator for the minimum 30 days. So, and
at room temperature.
At room temperature. So, and even in places where in the summer months where our temperatures go beyond 40, we can always have mechanisms where we can store them under that. Because even the regular people who are very poor, we always tell them to put the insulin vial into a cover and drop it into a bottle or in a glass of water. So, because normally the temperature of water is less than the room by 4 to 5, 7 degrees at least. So, the insulin in that temperature itself is quite stable enough. And people who can carry a pack which is cool, you can put it with your bag and insulin can be carried with it. Many times we suggest them to carry a flask, steel flask with some ice cubes and put it the insulin along with a cover. So, depending on the requirement, we can always plan. But what is difficult is to say that, okay, you shift to these tablets when you are traveling. But patients do that. It's beyond our control, but it is not recommended to do that.
Now, doctor, like we've been seeing that onset of diabetes has been really early nowadays. Now they start medication with a very early age. Do these medications have any side effects on them?
These medications what we use are what has been in the usage is all those medicines which have been rigorously tested. So by themselves these medicines do not have any problems. But what is important to realize is that the complications what a patient sees in a diabetic is not because of the medication, it is all because of the diabetes itself. So if a person with diabetes develops renal failure, it is not because of the medication, it is because of the diabetes itself, because that is how the disease presents and progresses. So what is a misconception is that many patients are worried about more about the complications than the benefit of the drug. So it's very difficult to stress upon complications rather than stressing upon the benefits. So you need to look at both. Benefits should outweigh the complications, and the complications are never because of the drug. And most of the patients who develop complications are never because of taking medicines, it's always because of not controlling the sugars. So it is ultimately we need to convince them that these drugs are safe, and again each of these drugs are tested and we have a limit. We do not cross a certain dosage beyond which is of no use and our complications come. So the complications of these drugs are very minimal. And if a patient's on a complication, we remove a certain drug is not because of the drug causing a complication. It is because this drug cannot be used in a patient of a certain category. Say for example, I cannot use a certain metformin, for example, I cannot use beyond a certain amount of creatinine. We usually keep it as 1.6. If it crosses 1.6, I need to stop metformin. That does not mean metformin caused the renal failure. So this is a drug which is dependent on the kidney to go out of the body. So I cannot use this drug. And most important is that many of the patients are more worried about the drug causing complications than they are worried about the complications of diabetes itself. So what we need to look is that the disease is more harmful than the medications.
Now, medication apart, once you're diabetic, people recommend a host of home remedies like drinking fenugreek water or cinnamon tea or even bottle guard for that, bitter guard for that matter. So does that do they really help in managing blood sugar levels, doctor?
These are all scientifically proven, because we all know that the plant, for that matter any food, they have both beneficial and harmful effects. But whether you look at fenugreek or the bitter gourd, they have some amount of chemicals in them which not only slows the absorption of blood sugar, sugars from the intestine into the blood, but they also have some amount of chemicals which reduces the insulin resistance. So these are all scientifically proven to have a benefit. So as long as you rely to such extent, it is very good. So you cannot over rely on these medicines to control your sugars. So they have a benefit, use it, and limit yourself to understand that these have a limitation. You cannot control your sugars by only consuming these things. So when ultimately the other medications are equally important, but by taking these, your requirement for regular medicines may be lesser.
So they go hand in hand.
Yes. So they are supportive to the usual medication. And many a times, even the consumption of, for example, people to lose weight, they consume honey and water and other things. So the benefit in these things is not because of what it contains. It is because that you are already filling your stomach with something, and probably the meal which is going to follow is going to be less in quantity. So these are the things which individually makes the controls your intake, and not only have an impact on the amount of sugars is overall which is going into your body, but also it fills your stomach, so your satiety becomes easy. Because what we find is that many patients are willing to diet, but they are unable to control their appetite. So these are the foods which do reduce their appetite and control their satiety. So they feel that after a certain amount of food, that they feel that they are happy with what they have finished, and they stop eating. So these drugs, these home remedies should be prepared at home rather than relying on the outside people, because we do not know what it contains. So as long as they themselves prepare and they are sure about what they are eating, it's well and good.
Lot of myths are associated with foods when it comes to diabetes, doctor. Like for instance, they say jaggery is the best substitute for sugar. Now, is that true?
Jaggery and sugar are same for technically, because they are both contain sucrose. The sugar what we use is a refined sugar, whereas jaggery is an unrefined sugar. So it contains more dirt, and it is jaggery. If you clean it, it is a sugar. So, and again there are also myths where people feel that organic jaggery is good for sugar. Nothing like it, because when you say organic, we are not talking about the amount of sugar it contains. We are only talking about whether chemicals it contains. So we are only talking about whether pesticides are used in preparing the sugar, other chemicals. So otherwise it is phosphates, they use it to clean the jaggery. So organic sugar is as bad as the regular sugar or the regular jaggery. So what is important is that any product made out of sugar cane is same. Whether you consume sugar cane juice or the jaggery or the sugar, it is the same. So it doesn't make any difference. But what it makes a difference is certain type of sugars which are again made from the sugar cane, what we call fructose. Fructose is a natural sugar which is manufactured from the sugar cane. But we all know that is what we call levo sugar, because dextrose is a right-handed sugar, levo sugar or fructose is a left-handed sugar. Our body metabolizes the dextrose or the right-handed sugar, which is normal sugars, by using insulin. Whereas the levo sugar is also manufactured from the sugar cane, can be burnt in the body without the need for insulin. So it is a fructose pathway which is independent of insulin. The other important thing about fructose is that it is 4 times sweeter than the regular dextrose or a glucose. So because it is more sweeter, the amount of calories you consume when you use fructose is less. So you will use 1/4 of what you are otherwise using. So to such extent, fructose can be used. And again, even in the synthetic or the artificial sweeteners, certain types of sweeteners are prepared from the plant, that is stevia plant. And there are certain amount of roots which are also can be used to prepare sugars. These are all natural sugars, can be used. But again, we need to be sure that these are not loaded with calories. So as long as they are 0 calories and plant based, they are safe. And even in the non plant based or the fully synthetic sweeteners, we do not worry much about it as long as your quantity of consumption is less. So the longer complications what we suspect is many of these totally artificial sweeteners may have a risk of cancers. So that is a worry. So these things we need.
Artificial sweeteners as in synthetic ones.
Saccharin and other things are totally synthetic sweeteners. So these have a tendency to have complications. Again, this cannot be used in a patient with type 1 diabetes. So because they have complications because of other things, and there are certain deficiencies of enzymes, they cannot consume them. So we need to be careful. But otherwise, as long as you know what you are consuming, and when you are using it in a moderate way, it is, I think, fine.
Now, as you said, sugar is sugar itself. Any form of sugar is not
Correct.
good. But nowadays we see ads on TV saying use our sugar, it has a lesser glycemic index that will help control your sugar, plus you will not get diabetes. How true is that?
Not true, because all
Very
sugars are
misleading.
same, irrespective of whether it is the way it is prepared, because unrefined and refined, to that extent there is some amount of change. But ultimately they are sugar and they all enter the bloodstream faster compared to the other type of unprocessed food.
So they are all basically misleading.
Correct.
And what about the health drinks, doctor? Some people say, many brands have come up down today and they say drink this whatever health drink, and then the very first day you will see the change in your sugar levels. They'll control your sugar levels and things like that. How true is that?
See, basically what concept they are trying to do is use more protein. So the thing is that protein does not require insulin. So we are sparing the insulin in the body by giving protein. So this, to that extent, correct. Second thing is that protein is more filling. So you feel full and your appetite is under control. So you don't feel that much hungry. So you are able to control your diet. The third important thing in this is the monetary involved. So your commitment, because these are the products which you have spent a lot of money to consume. So when you have spent some money, so there is a subconscious understanding that if you fail in controlling your weight or sugars, you have lost some money. So there is some commitment which comes because of that. Otherwise the proteins can always be consumed without spending. So there are products which are soya based products, again because we all know that soya contains more amount of protein, and when consumed it fills your stomach, so it takes more time to digest. So you can use natural soya based food, and many people already prepare their chapatis and rotis by using soya protein. So they are good in the longer run. And even patients who skip their meal by consuming could be natural products at home. It's ultimately what we are trying to cut down is calories. So you can always do these cutting calories by spending less. So when you spend for the products, the only thing is that the benefit what you get is disproportionate to the amount of money you have spent. So the money you have spent is not worth the value for the amount of benefit you get. So you need to be carefully weigh that and then take a decision.
And now coming to the latest trend, doctor, everywhere there is a thing called reversal diabetes reversal. Maybe go to a fitness center or follow a certain diet that reverses your diabetes. Now, is that true?
The word diabetes reversal is a wrong word to use, because again they use it basically to make a patient, convince the patient. But the correct terminology what we need to use is diabetes remission. It is like a cancer patient, because whenever we treat a patient with cancer, we never talk about treatment or a cure. We always talk about remission. So there is a patient with cancer, how long I am going to keep them alive without progression. So it is the same thing with the diabetes. So what we call diabetic remission is a concept where a patient has come with diabetes, and how can we reduce or stop the medication in a particular of patient. So if I reduce the number of tablets, it is already a partial remission. But if I stop the medication altogether, it is a total remission. But this remission can happen only with a particular or only a small component of diabetic patients. It is not for everybody. Patients who are obese, morbidly obese, by losing weight, but that again the weight loss has to be beyond 15 kgs. If these patients lose weight beyond 15 kgs, because this weight loss is related to a direct fat loss. So when they lose this fat, the amount of insulin required by the body will automatically come down. So their existing insulin itself will start working better, and these patients may slowly go out of medication. Again, it is a concept which we need to weigh with a balanced mind, because whenever these patients go out of the medicines, what we need to keep in mind, it's only a phase or a honeymoon phase where we call these patients go out of the medications, and it's only a matter of time these patients need to start their medications again. And that again depends upon their commitment and their weight loss and how well they manage their diet. So there are patients who can manage without medication only for as less than 1 year. When we say remission, we are talking about controlling without medicines for 1 year. And there are patients who can manage with remission for 7 to 8 years. Okay. So, but this is a very small proportion of patients who can manage this long. But many patients require medications. But again, what we need to understand that we see only talk about patients who go out of medication. We don't talk about patients who go out of medication, but when they come back, their blood sugars are very bad than what they were in the initial stage.
So it is not a good healthy practice.
So we need to always keep in mind that although remission is good, and although if we can stop medications to a person who is committed, is very good. But if a person is not committed, when they go out of medication, the next time when they come back, their sugars are far worse than where they were in the beginning state. So at the end of the day, they they may require more medicines when they were trying to avoid things. So it's a thing. So and again, many a times when we see that these patients are not committed or very difficult to make them committed, we always tend to reduce the medicine rather than stop it altogether. So we make at least come to a half tablet and then continue even though their sugars are under control, we continue to keep a small dose of metformin at least, because we all know that metformin reverses diabetes and they prevent progression of diabetes. So we keep them on this medicine for a longer time even though their sugars are under control, because one, that reminds them every day that they are diabetic. Second thing is that by mechanism of action, it prevents progression. So when their sugar do get worse, the requirement of additional medicines is very less. So when we talk about remission, we need to be very careful. Never fall prey to words saying that diabetic reversal, because it's a misnomer, and many a times we don't. It is same as weight loss programs, because all patients project them what was their weight before and what was their weight later, but they will never show what happened to that patient 5 years down the lane. So when we never see the patients who went on a remission, but what happened to them when they came back on medication. So we will never see that category. No advertisements will be given when they come back and become diabetic.
Another doubt is that, doctor, when they say drinking whole milk also increases sugar, is that true?
It is not always true, because what we need to understand is that casein is a protein which is in the milk, and there are theories where patients may not tolerate casein very well, and casein increases the insulin resistance. So these are the category of patients where they do recommend avoiding milk as a product to increase, which will make them predisposed for diabetes.
How do they recognize it?
And again, there are patients who have lactose intolerance because they have tummy upset the moment they consume milk. So these are the patients also, because then we all know that the milk contains lactose, which again may worsen the diabetic profile. So it causes more insulin resistance, but it is not always true. So actually, when we look at the Indian women, we always tell, because compared to Western women, more Indian people are vegetarians, and their only source of calcium may be milk in an Indian scenario. So we never recommend not to consume milk totally, because at least for women we recommend, if you do consume milk, continue to take 1 glass of milk every day to keep your bones harder. But that milk needs to be moderated, and again you need to consume that in between the meals. So it's a snack time. So try to take milk without the food, so separately, so it does not impact your overall blood sugar control.
So consuming more proteins in your food, does that help diabetics?
Yeah, because protein and fat are metabolized by the body independent of insulin. So, but fat cannot be a major part of the meal, because bodies are not, our human body is not prepared to handle more fat. So whereas the protein and carbohydrates can be managed by the body. So in a diabetic patient, when we are trying to cut down the carbs, we are trying to push more them to the protein, because protein gives more energy than compared to carbohydrates, but in a slower pattern and in a more healthier pattern. So consuming more protein, again the other advantages is that protein is more filling than carbohydrates. So you will probably consume less, and it takes more time to digest, so you will starve a longer time.
But I've also heard that it is a pressure on kidneys. Is that true, doctor?
Not necessarily, because as long as your kidneys is normal, they are able to handle that. So only when there is already a patient with renal failure, these are the patients who restrict protein, because nitrate comes from the protein and they have an impact on the kidney function. So, and nitrates is nothing but urea and ammonia. So, we need to control protein intake in those patients who already have a pre-existing renal failure. In a normal person, the proteins are have no impact on the kidneys.
Now, how does alcohol and smoking influence diabetes?
So, what is important that we are only calculating calories in a patient with diabetes. 1 gram of sugar or 1 gram of carbohydrates gives 4 calories, whereas 1 gram of alcohol gives 9 calories. So, the energy what you consume when you take alcohol is more than what you consume when you take sweets and sugars. So, this is one thing. Second thing is that when you consume sugar or carbohydrates, and if you are not a very bad diabetic, body at least knows that there are sugar or carbohydrates which have entered my body. So, to what extent is a difficult thing, but at least the body will try to correct it. So, the body produces more insulin to control sugars and will try to control the amount of impact. But when you consume alcohol, body does not know that this amount of calories has come, because there is no mechanism to burn it. So, automatically you get more energy. And many of these alcoholic preparations are made from malt. So, they will also have carbohydrates apart from alcohol. So, even though you may say that this contains less alcohol, your consumption of carbohydrates in the form of malt is more. So, ultimately the energy which goes with alcohol is not good. Second thing is that these do have some impact on the liver, and because we all know that the liver is an important organ which takes away all that extra sugar in the blood and controls your blood sugars. So, the fatty liver, what we call, is a progressive thing which can be more predominant in patients who have alcohol. So, the fatty liver predisposes them for a poorer sugar control. So, we have an organ which is trying to control blood sugars, but we are having an impact because of the alcohol. But then again, smoking is a different spectrum altogether, because Indian diabetic patients have a very high risk of having a heart problem. Half of our diabetic patients die because of the heart attacks or cardiac mortality. So, these patients when they have smoking, this not doubles the risk, but it triples the risk. So, it is 1 plus 1 is not equal to 2, it is 1 plus 1 is equal to more than 3. So, when you become diabetic, your risk for heart disease is already worsened. So, when you have diabetes plus the smoking, your risk for development of cardiac illnesses becomes much more predominant, and the likelihood of becoming having a heart problem becomes more. And because of that, we recommend not to smoke in patients with diabetes, because you already have an illness like diabetes which makes you a riskier candidate for heart problem. So, do not pay and buy a cigarette and or any other form of tobacco to get yourself more prone for an extra risk of cardiac. Again, when you develop cardiac problem, you need to spend for that treatment. So,
any form of tobacco for that?
Any tobacco form, because all tobaccos are harmful for the blood vessels. So, tobacco by smoking is harmful for the lung plus the risk of heart. Tobacco by oral is harmful for the mouth plus the risk of cardiac illness.
Okay, doctor. And there's a huge research which has been going on in the field of diabetes. So, where do you see the future for the treatment in terms of treatment?
So, I think in diagnosis of treatment of diabetes, now there are machines which are slowly going to come, like our pulse oximeter, where you don't have to prick to know the sugar. So, maybe over a period of time we will have machines which without a prick you can find the blood sugars. So, maybe over a period of time we will have smart watches which shows your blood sugars, records the blood sugars without a prick round the clock. So, this will be the part of diagnosis thing. And coming to the diagnosis and treatment part, a lot of changes, because what I was doing 10-15 years back is no longer what I practice now. So, in the coming years we will definitely have better medicines to treat, whether it is insulin, because earlier insulins were given 3 times, then it came twice. Now we have basal insulin which work for 24 hours. Recently there was an insulin which Novo Nordisk tried to get permission, and of course it was declined, but which insulin needs to be taken once a week. So, the concept in the coming days will be to give less pricks per day. So, the other thing is the insulin delivery mechanisms or insulin pumps. So, the earlier insulin pumps were the ones where we were checking the blood sugars feeding the amount of dose to be delivered. These devices used to deliver the dose which we have advised. We have set that machine. So now the newest or what we call the latest is what we call an artificial pancreas, is by a company called Bionic, and the model is called islet. So it is called islet bionic. It's an artificial pancreas where it has two components. One, it has a CGM, and it also has an insulin pump. So both are interlinked. So the CGM will check the sugars minute to minute and give the report to the insulin pump, and the insulin pump delivers the insulin based on an algorithm which is already a software based algorithm. So without the patient's interference, the insulin pump delivers the insulin required based on the blood sugar reports. So it goes on like an thing. Only need is that they need to change the insulin delivery needles at a set frequency. Of course, it is expensive, but these are the available options to many of the patients. And even in the molecular levels, we have platelet, the beta cell transfer or the molecular treatment. We have a recent approval for a type 1 diabetic patients whose blood sugars are not well controlled with multiple insulins. So these patients have a transfusion of cadaver beta cells. So the cadaver pancreas is processed, the cells are artificially developed, and this is injected into the portal vein, which is a vein which takes the food from the intestine to the liver. So they give the injection to the portal vein, and these because we all know that the liver is a filter, it catches these cells, and these cells grow there, and they produce insulin like any natural cells. They measure the sugars and then accordingly produce the insulin. But the only problem with is because this is like a transplant. So these patients need to be on medicines like a chemo transplant patient. So we need to keep their immunity under check by taking medicines which are given for transplant. So there is one. So in the coming days we may have oral insulins. Of course, our own Biocon did try some oral insulins but failed to give a long term benefit, so it is no longer in the project. But there are companies which are trying to give oral insulin deliveries, but we will have a challenge because insulin is a protein, so there are challenges in preventing it to be digested from the stomach and intestines. And the insulin gene therapy is going to be a long term where patients will be diagnosed who are the patients who are at risk of becoming diabetic. So they can be checked when they are young, and we may have mechanisms to change their genes altogether in the beta cells and prevent them actually becoming diabetic. And even in a type 1 diabetic, there are drugs, because we all know that when they become type 1 diabetic, there is an initial phase where there is a damage of the beta cells going on. So there are monoclonal antibody drugs which are available now to stop that progression. So the type 1 diabetic, in the stage 1 itself, we stop their progression to become stage 2, or they becoming stage 3, which is a type 1 diabetic full blown. So drugs are available to stop that. It is already in the market. And gene therapy is where we also change. If a person is already diabetic, we may coming days we may have cells which become beta cells, because in the marrow we already have, because cells when it is injected they go home in, what we call home in, because these marrow cells are home to go into the bone marrow. They go reach there and become the marrow cells. So the coming days we may have tissue modifications or genetic modification cells which can be delivered like a transfusion, and they go into a body and have produced their normal natural insulins based on the blood sugars.
So that time diabetes
Correct.
reversal
So,
can
but
be
what?
a reality.
But that will be a reality. But what we need to understand is that to get all these benefits, the present patients or present generation of patients, they need to keep their health in good control, because whatever is available can be beneficial only if they are in good health.
Right.
So coming days is going to be more challenging.
So what is your final piece of advice to our viewers, doctor?
So what we need to understand is it's a very common illness. We all know that in India, 17% of the Indian populations are diabetic. So 1 out of every 6 person in India is a diabetic. So it's a large population. And out of these 17%, many may not be aware, so they need to be more aware. Awareness is important. They need to check for themselves whether they are going to be diabetic. The other thing is that diabetic is not a serious disease. They can live with the diabetes. We all know that Wasim Ikram was on insulin and he lived normally. He was playing for the Pakistan cricket without any problem. So we need to understand that diabetes is not curable, but it can well managed, you may not have any complications and you may live normally like any other person. So it is a it's no longer a taboo to become diabetic. Many a times knowing that you are diabetic is early makes a lot of sense, because you can start your changes in your lifestyle, prevent progression of diabetes very early. So instead of avoiding checking yourself and to prevent just to prevent medication is not correct. Check yourself early, diagnose yourself early, take treatment early, start the medication at the right time. Never delay medications, because the more you delay, the more number of medicines you end up taking. And you will not only be taking medicines for diabetes, but also you end up taking medications for the complications.
After talking to you, I've just realized one thing, that diabetes is nothing very scary. It can be well managed.
Correct.
And we can actually lead a very healthy
Correct.
life too.
It is more a lifestyle disease where you need to do a lot of sacrifice in how you manage your day-to-day life, food and other habits. But otherwise it is a very simple thing. Once you fall in line and you have a methodical way, I think blood sugars can be managed in a more proper way, and you don't have to worry about complications, because complications happens only when you are very poorly managed. So a little under good sugar control, automatically your complications is less and you can live like anybody else.
Okay, doctor, I think you shed so much light on the diabetes and things like that. I'm sure our viewers will definitely benefit out of it. Thank you so much for being on this show, doctor.
Thank you.
So viewers, after speaking to the doctor, we've realized that diabetes is not as scary as it looks. Managing it well helps us in the long run to manage the disease itself, and we also having a very healthy life. For more such interesting content, keep watching NewsFirst Prime.